are some of the ways mental health affects our community, and what can I do to help?
So one of the long-term ways that untreated mental health issues affect our community is that it can lead to homelessness. The different ways that we see this present even with our students, right, when it hasn't gotten to that point yet, but when students are young enough and are experiencing mental health concerns that go unnoticed, it can lead to poor grades. It can lead to dropout. It can present as substance use. Also, that lack of access creates barriers to success, right? And so when our students aren't getting the supports that they need, that's when we start to see them fall behind in class. That's when we start to see dropout. And then also it can present in other ways too. So maybe it's manifesting as just other behaviors that the school might not be catching on to. So maybe it could be a student is fighting frequently at school. It could be a student is engaging in risky behaviors at school. Maybe it's, impulsive behaviors. And so those are just some of the ways that we can see it with our younger populations. As far as being able to help, again, it's about finding those trusted adults in our lives. And so whether they're older friends or family members or just other community members or folks at your school community, and making sure that you're connecting with them. They can always help you get the help that you need. And so I, again, always go back to the New Mexico Crisis and Access Line. We also have a lot of other resources that are available in this community. It's really amazing how much just getting someone hooked into just talking about their issues and then going through that process to get those wraparound supports that they need.
So, especially now with COVID, we're seeing mental health effects, all over the place, all over the world in our communities that we reside in. And so I think also we've isolated, and it's isolated us as a community. But I also think in some ways too, we've used technology in a way to bond to each other. And so I think that's a strength, that technology out of all of this has really paved the way for us to be able to communicate and have those bonds, even though we can't have those physical in-person bonds. So I think there's been good things that have come out of it, but also things that, have been negative things too that we need to work on. And so I think just coming back together, and I don't think the world's ever going to be the same now. I think we're using technology in such a different way than we ever did before. And so I think that's an awesome thing for teenagers because they grew up in a technology world. It's not like my generation where I didn't grow up with technology, and that kind of happened as as time went on. These kiddos grew up in technology. They're all about technology, and so I think that's been a great thing for them, having that that resource out there for them to be able to connect to their peers, and even for them to reach out for mental health professionals too, using technology.
Well, I think we all know that mental health issues are very significant. They impact on a significant number of calls to the police and to emergency medical services, both related to people homeless in the community, people who have significant substance use disorder problems, and some patients who are psychotic. Who have trouble controlling their behavior. And those, all of those issues have a huge impact. We know from just what's happened recently in terms of the mass shootings that the concern about the interaction of mental health issues and those shootings can be significant, although it's important to note that the majority of individuals who have mental health issues are not violent. But it can happen for sure. So those all impact on our community very significantly, and it impacts on, it can also impact on the homeless population as I've mentioned. In terms of how to help, there are community resources where you can help.
I think the way that mental health affects our community we see in a lot of different ways. So we know that, for example, in Albuquerque, there's, like many big cities, right, we have some issues with substance use as far as a lot of adults or teenagers who choose to use substances to cope. So that's one way, because a lot of people that use substances also have mental health conditions. I think when people are struggling with whether it's depression, anxiety, any host of mental health conditions, often they're not able to function like they might if they were healthier, or that they might want to. So you can see impacts on people's ability to do their jobs or to get to their jobs, people's ability to support their families, for parents to feel present for their kids, for teachers to be able to do as much as they'd like to for their students, for example. So there's certainly those impacts. And then, as well, we know that a lot of people who are homeless or who don't have great social situations as far as more stable housing and such, many of those people also have mental health conditions. So it's a lot of different areas, but we know for teenagers that this is like a very important part of life, and that, for teenagers or for your peers who are struggling, that can also really impact how someone thinks about their future, how they plan for life beyond high school, or what their hopes and dreams are, and how they really have hope about being able to do things that matter. So there's pretty significant impacts, and sometimes with topics like this, it can feel just too big sometimes to really think like, okay, I can do something about it. But I do think just small things like, taking care of yourself, and then reaching out to people that you know, or being a support for people that you know, or if there's a cause that you care about that has a mental health connection or root to it, getting involved in some of those. Those are all really nice places, I think, to be able to start as far as thinking about like building up our community from mental health concerns. So.